Hi, brothers and sisters. We wanted to talk to you today, particularly because it's Workers' Memorial Day, and we all know that it seems that this year we're struggling with this virus in our workplace and the typical problems that we have all year. And while there's a lot of focus on the virus, and there needs to be, and we can't allow our workplaces to get opened up and not be right. We need to keep in mind that we have 5,000 workers killed a year in the United States at work as a result of workplace accidents, and we have so many more that die related to sicknesses and illnesses that they contract in the workplace. So we have to be diligent about all that, and we can't just deal with today's problem because this problem exists for workers all year long. And fortunately, it's beginning to get some focus right now because of so many people who are on the front lines and are putting themselves at risk to be in their workplaces. And the whole question of personal protective equipment is becoming important, and it's gotten some play. And people are beginning to understand that at work and in jobs, you need safety equipment, and you need what's provided in order for you to keep yourself safe at work. And it's always been a fight for us in our workplaces and our unions to ensure that we had the right personal protective equipment and that the companies weren't charging us for our own PPE. And in this climate here, we've got to be diligent and make sure that when we do go back to work, and this union wants to see this country back to work as quickly as possible, but we can't go back if it's not safe. And our places need to be safe. And our union, along with all the AFL-CIO unions, has been pushing the administration and Congress to include a special emergency act of OSHA so that we have a law to rely on when we do go back into the workplace. And so far, that hasn't materialized. And we're going to continue to have that fight. And we're going to reach out to you in the workplaces to help us in that fight to try and ensure that workers in America have a law that they can rely on and they can go to OSHA and invoke some rights when their workplace isn't being kept right or they're not having the right personal protective gear. And that ought to exist all year long. But right now, in the middle of this crisis, it's more important than any other time. So, look, it's 50 years since OSHA was first enacted and we had that law. And it's been 40 years since the Mine Safety Health Act has come into place. And in our union alone, since our last Workers' Memorial Day, on April 28th of last year, we've lost 35 brothers and sisters who were killed on the job. And that's not counting our members who have died from this virus in the last month or so. And we're not certain that all of those are contracted in the workplace. And so we're not necessarily counting them that way until we know more about them. But 35 others have died and been killed in our workplaces. And the foundation of our union has always been a strong safety and health program, the right kind of technicians and expertise available to you, and a strong safety committee in our plants. And now more than ever, you've got to be very diligent, and we've got to watch out for each other out there. And this is not a holiday. Workers' Memorial Day is a memorial to people who went to work, had every right to expect to go home and go home safely. And we see that in both our nations. And while it's been 50 years here since OSHA was enacted in Canada, we've been fortunate to get enacted the Westray Bill and have a good focus on safety and health in Canada as well. And we're sort of highlighted now by what's going on. And we have to take this opportunity of this discussion of workers in their workplaces being safe to drive this message even further and deeper so that people understand that those folks who are out there day to day, taking care of the rest of us, and who are doing the work in this nation to keep it going, are putting themselves in harm's way. And they shouldn't be doing it without employers who are doing the right thing beside them. And so, in our workplaces, without an OSHA standard right now, the union's going to need to be more diligent than ever in pushing and fighting to make sure places are safe, that the bosses are doing what they need to do, that they're disinfecting our shops the way they need to be, that we have the protection to go in there, and they're not saying, well, go buy your own stuff. So we're going to have a tough time as this goes on. And there's going to be a more stringent focus on safety than there's ever been before. But we can't forget and get sidetracked just by this, because our workplaces are deadly enough as they are. And now we're compounded with this. So our message to you this year is the same message that you hear always, but it's more poignant this year. And we're gonna fight for the living and mourn the dead, but we're gonna fight and make sure that our union is safe and our members are safe. So we want to deliver to you this day through this video message. Typically on this day we gather together. We remember who our co-workers were and who lost their lives, and we hold memorials in a lot of our union halls and in our workplaces. And just under these conditions, it's harder to do. But we can do it this way, and we can use the tools we have at our availability. So stay safe out there. Keep an eye out for each other. Look out for each other. Don't expect that anybody else is going to do it for you. And stay together. We're all going to come through this together.
the sound that saved a wretch like me. I once was lost, but now I'm found. I was blind, but now I see.
Although we are not together in person on this Workers' Memorial Day, we still stand in solidarity with fallen workers as we battle the coronavirus pandemic around the world. Our healthcare workers have shown us that they're true heroes, whether they're on the front lines of patient care or servicing our healthcare facilities and housekeeping, maintenance, labs, or other roles. Our healthcare workers has risen to the challenge. But their work does not come without great risk. And today is a solemn reminder that our work is far from done. We are fighting harder than ever to make sure our workplaces are healthy and safe. And whether you work in a hospital, a nursing home, a mill, a mine, or an office, the United Steelworkers has been at the forefront of worker health and safety. And we have spent decades fighting to uphold safe workplace standards. This year marks the 50th year of the passing of the Occupational Safe and Health Act, and we are in the midst of a once-in-a-century pandemic. Respiratory protections for healthcare workers on the front line have been rolled back. The Chemical Safety Board, an organization that investigates industrial explosions, has vacant seats. The National Labor Relations Board has made decisions that threaten our right to bargain over health and safety issues. And the environmental protection continued to be put on the chopping block. Last week, the EPA weakened restrictions on mercury pollution. So it is clear today than ever before how significantly workplace exposures can impact all of us. Every day of this pandemic, we are watching the effects of the virus with workers who are working with insufficient PPE, with healthcare workers that makes up 20% of COVID-19 infections. And steel workers in every district are coming together, showing their creativity and ingenuity by creating and donating personal protective equipment to frontline caregivers, from homemade masks to 3D printed face shields. Our members across the United States and Canada have worked to move available PPE to local workers in need. Our union's diversity is our strength, and our solidarity in action is what it means to be a steel worker. But even with PPE, many workers have died or have been sidelined for weeks due to contracting this virus. And this affects the communities of color at a higher toll. In both Chicago and New Orleans, for example, Black patients and brown patients account for over 70% of coronavirus deaths, even though they make up roughly a third of the population. And Black families and brown families face a much higher risk of contracting and dying from this virus. Residents of majority Black counties have 3 times the rate of infection and almost 6 times the rate of deaths as residents of majority white counties. And recently, last week, Morehouse School of Medicine hosted a webinar entitled Ring the Alarm, Black Nurses Speak, to discuss health and economic justice. And one of our own nurses, Dejanae Shaw from Local 7600, she captivated the webinar audience and spoke truth about her experience demanding PPE. And Dejanae shared the groundbreaking enhancement benefits bargained by her union for union employees impacted by the coronavirus. So we can honor the sacrifice of workers who have suffered and died as a result of their jobs by advocating for stronger safety protections at the work site. We can take action by ensuring that the downgrading of safety standards does not continue. But let's take a moment and call out the folks that's doing it right. We must lift up states that are presuming COVID-19 infections for frontline workers came from occupational exposure and will be covered by workers' compensation while pressuring other states to follow suit. For example, in Minnesota, the new law provides that employees on the front line of the COVID-19 pandemic are presumed to have contracted a workplace compensation occupational disease if, unfortunately, they become ill with COVID-19. And lastly, we can commit ourselves today to get every local involved in our health and safety program and fight for safer workplaces by coming together like we are today and taking on these issues by having effective health and safety committees that focus on why or how an injury occurred instead of who. Creating workplaces where all workers have the right to refuse unsafe work without fear, and ensuring that workers receive the training needed to perform their work daily and safely. So we will come together and we will continue to stand up for all workers. We're working nonstop to demand PPE and other safety equipment that our members need, pushing for legislation and regulatory at every level in government to put workers' health and safety before profits, and doing everything that we can to ensure our healthcare and other essential workers get the pay and the benefits they rightfully deserve. So let us leave this broadcast fired up and ready to fight like hell for the living. And to talk about ways we plan to do that as a union, please welcome Steve Salmon of the Health, Safety, and Environmental Department, and Ashley Fitch of the Tony Mazzocchi Center. Thank you.
Thank you, Fred. I'm Steve Salmon. I'm with the Steelworkers Health, Safety, Environment Department. I'm the Assistant Director. As we continue to fight for safer workplaces, I'd like to point you to the USW website on COVID-19 by going to usw.org/COVID-19. There you will find helpful resources. For example, the fact sheet on Workers' Memorial Day on the actions that you can take and information during these unprecedented times. We have information on health and safety related to COVID-19, respirators, mask and cloth facial coverings, disinfectants. We have a guide for local unions who are at work or returning to work, including nursing homes. There's guidelines from the Center for Disease Control, OSHA, the World Health Organization. And if you'd like to report a health and safety issue related to COVID-19, you can find it there as well. We also have additional information in Get Involved for the Health and Safety Department. We have fact sheets, hazard alerts, and a section on the Looking for Trouble, the USW's comprehensive labor management, health and safety systems, as well as many other publications on our webpage. We ask that you continue to work with your local union, as well as the staff representative in your district and district director. If you have any questions for us, please feel free to reach us at safety@usw.org. So keep finding and fixing hazards. And at this time, I'll turn it over to Ashley Fitch.
Thanks, Steve. Those are a lot of good fact sheets that you can print off and share with your membership or your local union leadership. But we know that there are other ways to communicate. We have tools like social media platforms, video calling, and webinars. And we also know there's a lot of misinformation out there. To help you guide through the sea of information, we wanted to provide another opportunity for us to connect through these social platforms. We will be hosting different Facebook Live events, live training sessions, some pre-recorded videos for you to reference. Making sure you get clear information is important, especially when we're dealing with public health measures like social distancing and group sizes are challenging in our workplace. I know that we would rather be together, especially on a day like today, and I know at one time we will be. But until then, know that your union is here to help provide clear information on how to stay safe at home and at work. It is situations like these that test the power of our union and challenges the strength of each of us to become stronger. And today, to become even stronger for those workers who have died on the job, and for all those workers who continue to go to work to a variety of hazards, some of which can be ultimately deadly. We look forward to hearing from you and hope you are able to join us at one of our many upcoming events. We also hope that you take some time today and stand in solidarity to honor these fallen workers and to fight for safer and healthier workplaces that workers were guaranteed over 50 years ago by the passing of the Occupational Safety and Health Act. Remember, some of the hottest fires forge the strongest steel, and we all need to stay strong, take care of one another, and fight like hell for the living.